name is Sarah, and I'm going to be your nurse today doing head-to-toe assessment. I'm washing my hands and putting on gloves. Do you know your full name and date of birth?
James William Babcock, 1218.
All right, and where are you right now?
The doctor.
My patient is alert and oriented times 4. I'm going to ask you 3 subjective questions. First, I'm going to give the general impression of my patient. My patient is sitting upright. He appears to be in no obvious distress, and his facial expression is relaxed and appropriate for the situation. Now I'm going to ask 3 subjective questions. Have you ever had any injury to your head, neck, or spine? Ever had any abdominal surgery? And have you ever broken any bones? Perfect. My assessment is then going to move on to the integumentary section. I'm going to assess the moisture, the turgor, the color and temperature of your skin. So we're going to just kind of feel lightly. Skin is pink, warm, and dry, and we have rapid recoil. Next, we're going to move on to the HEENT and neuro section of our exam. So I want you to just read what's on my badge for me.
Boston Course Memorial College.
Perfect. Cranial nerve 2 is intact. Then we're going to move on to cranial nerve 3. We're going to assess your pupillary response. Just take your glasses off for me. Sorry. All right, and his pupils are pearla. Then we're going to move on to cranial nerve 7. I want you to smile really big for me. Perfect. His face is symmetrical when smiling. Cranial nerve 8, his hearing is intact according to our conversation. Cranial nerve 11, I need you to just shrug your shoulders against pressure for me. Perfect. And I want you to turn your head side to side. Perfect. Cranial nerve 12. Cranial nerve 12, I need you to stick your tongue out for me and move it side to side. Perfect. All cranial nerves are intact. Then we're going to move on to the cardio section of our exam. I am going to start off by checking for any jugular venous distension and check his trachea midline. So trachea is midline. We're going to check for jugular venous distension again with our pen light. Turn your head to the right and to the left. All right, I see no signs of JVD. Next, we are going to palpate the radial and brachial pulses. Oh, I'm sorry. I'm going to auscultate and palpate the carotid arteries. So just palpate one side at a time. I'm going to auscultate. Listening for any bruits. All right, and I heard no bruits. Now we're going to move on to the radial and brachial pulses. And they are present bilaterally. Then we're going to check capillary refill, which is less than 2. Next, we are going to move on to the temperature and color of the upper and lower extremities. We're also going to check for edema. They are pink, warm, and dry. And I see no signs of edema. Now we're going to check the pulses in the lower extremities. We would palpate the femoral pulse in the groin, the popliteal behind the leg, behind the knee. We're going to check the dorsalis pedis on top of the foot. And the posterior tibial. All right, so pulses are present bilaterally there as well. We're going to check capillary refill. Sorry, I'm going to take off your flap. And the lower extremity, just less than 2 as well. Now we are going to assess the heart rate and blood pressure that we took earlier, and they are within normal limits. Next, we're going to listen to the heart sounds using both the belly and the diaphragm. This is the acronym APE to man. So we're going to start with the aortic. Pulmonic. Erb's point. Tricuspid. And mitral. All right, then I'll flip my stethoscope over and listen using the bell. heard normal S1 and S2 sounds, and no abnormal sounds were heard. Next, we're going to move on to the respiratory system. I'm going to assess the rate, the depth, and any dyspnea. So his depth is even, his rate is normal, and he is unlabored. Then we're going to listen to the lung sounds. We're going to listen 6 posterior, 2 lateral, 6 anterior, 2 lateral, and 8 posterior. Perfect. 2 lateral. Right, and 8 posterior, avoiding the scapula. Perfect. Lungs were clear throughout, and I heard no adventitious sounds. Next, we're going to move on to the gastrointestinal system. When was your last bowel movement?
This morning.
And was it normal for you? Perfect. Go ahead and kick back for me. I need you to put your knees up. Perfect. We are going to listen to all 4 quadrants for bowel sounds, and then we're going to palpate light to deep. You hungry? Bowel sounds are present and active. Next, we're going to go ahead and palpate those 4 quadrants. Start off light. Let me know if there's any pain. Okay. Then deep. All right. No pain or tenderness, and noticed no bladder distension. We're going to move on. Go ahead and sit up for me. We're going to do the musculoskeletal and neuro assessment. I want you to just kind of pull and push against me. Perfect. Lower extremities. Perfect. Sweep my hands hard. All right. Muscle strength is 5 out of 5.